Okay. I think we're coming on live. But let me double check. Not seeing it yet, but there's usually a slight little delay. So hopefully, let me click in here. Yet, but there's usually a slight little delay. So hopefully. Okay, perfect. Well, welcome everybody. Welcome back. Sorry, I did not get a second one in last week, but here we are today. So for those of you who don't know me, my name is Lindsay Venn. I am a PA, a registered dietitian, and a metabolic health practitioner. My purpose here is to educate and spread the word on how to improve your health naturally without having to resort to traditional medicine strategies. And so tonight's topic is specifically on mental health and the gut-brain connection, as well as the connection to metabolic health. And so there's actually a lot to it, but it's very helpful and beneficial in my opinion. So please feel free to put a message in the comments section. I will try to get to any questions at the end. And then, if you're on YouTube or whatnot, I'll watch for those questions as well and respond back. So anyway, welcome. Let me share my screen. Oops. And we'll go from there. Let's see here. Perfect. Here it comes. Slowly, but it's coming. Okay. So again, too, I didn't mention before, you can find me at Venn Integrative Medicine if you want to book a personal consultation or have questions for me, please find me there. Again, Venn Integrative Medicine. So first, this is on your gut, your metabolic and mental health. And as always, there's this little disclaimer, I am not your doctor or your provider, and this is not personalized medical advice. It is intended to be here to educate you and give you what I call full informed consent when it comes to things you can do to improve your health. So first of all, when I say mental illness or mental health, what am I referring to? A lot of people jump directly to things like bipolar disorder or depression or anxiety, but there's a lot of different symptoms that can signify mental illness. So things like fatigue, anxiety, depression, different things like those, as well as stress, irritability, mood swings, brain fog is a common complaint I hear, and cognitive impairment. So I'm not just talking about your major diagnostic criteria for things like depression and anxiety. Any alteration in mood or cognitive ability does impact our mental health. And so where does the gut come into play here? And this is a really important piece. And I like this slide, and there's going to be several slides like this as we go throughout. But this is all a vicious cycle. You can see that we have a lot of double arrows going through here. It goes both directions. And so we have the brain that has a lot to do with our mental health. We have different neurotransmitters that are actually secreted from our microbiome. We have the gut itself there. There's things like the vagus nerve involved. And then there's, of course, our food. And so all of these things play a role when it comes to mental, metabolic, and gut health. And we're gonna dive deep. So the first piece of this, and if you followed me or watched any of my presentations before, you know that insulin resistance is a major driver. And it's really important that you understand why is this. So I'm going to briefly go over this. If you want a deeper dive into it, certainly go to my YouTube channel. There's several presentations on this, but insulin resistance is a problem that happens at the cellular level. Over here in this image that is probably small for you guys, but we have these different little receptor sites on our cells. Every cell in the body requires insulin in order to get glucose in. And so how it works is these insulin molecules floating around in the bloodstream that are excreted when we are fed will enter into this receptor site, and that will turn on this GLUT4 receptor that'll allow glucose to get into the cell and help the cell do whatever it's supposed to do. I very often will compare this to a lock and a key. So if your cell has a door on it with a lock and the key is insulin, what happens in insulin resistance is that lock is broken. And so if that lock is this receptor site and it's broken, the insulin won't work and it can't get glucose into the cell. And this creates an issue with inadequate energy being supported to those cells. And where does that become really, really important? Is this also includes our brain. And so if our brain, which is a very, very picky organ in the body, If it doesn't have glucose, it's not functioning properly. And the other picky piece about the brain is it really only wants one or both, I guess, fuel sources, which are glucose or ketones. And if you're following a standard American diet, you're not making ketones. If your brain is insulin resistant, it cannot utilize the glucose either. And so the brain will have dysfunction from things like type 2 diabetes and insulin resistance because it simply is malnourished, leading to things like Alzheimer's disease. That's what this AD stands for here. Cognitive decline, dementia, brain fog, etc. There's a wonderful gentleman by the name of Chris Palmer who is a psychiatrist, and he wrote this book. It's called Brain Energy. And he really dives deep into the fact that mental illness is 100% a metabolic disease. And so, why not try to combat it with metabolic interventions that mainly come from diet and lifestyle? And so, if you want a deep dive, and it's a pretty darn good deep dive, make sure to check out his book. He's got a website too, and he's a really nice guy. So, why is this a problem? Well, this is a problem because only 7% of American adults have good metabolic health. That means 93% of us do not. And what's even more sad is the mental health crisis is just following right in line with the metabolic health crisis. And so this was just a slide I pulled that shows that about 1 in 5 adults suffer from some kind of mental illness, while 1 in 20 have some kind of serious mental illness. And this number, again, unfortunately, just continues to rise, but it does speak very loudly to the fact that these two things, metabolic poor health or poor metabolic health, is very much tied and correlated to poor mental health. So let's talk about the gut-brain connection and how can we make all of this better when it comes to our microbiome. First we talk about the insulin resistance piece. We want you to do things to lower insulin, intermittent fasting, low carbohydrate eating, good activity, stress management, sleep, those kinds of things that I have dove deep into before. So now I want to dive a little deeper into some other contributing factors, and one of them is our microbiome. And so again, we have these arrows going in multiple directions, and that is because they interplay with each other. And so the brain will have a direct impact on things like our gastric motility, how quickly we can move food and things through our GI tract, the different secretion of digestive enzymes, insulin, things like that, the nutrient delivery, and then, of course, microbial balance. And then in turn, that microbiota, does have this ability to secrete neurotransmitters, and I'm going to go into that in a lot of detail, but it'll also create things like stress and anxiety, mood swings, behavior change, and whatnot. And so our microbiome really can impact our mental health to a significant extent. And I always tell people, this is where it almost becomes you are what you eat. If you're eating junk food, then the junk that the microbiome is going to be producing is also junk. So here's a little bit more complex slide, but I like it because it talks about how does this actually all work. So number one, factors that will compromise our gut microbiome. You see things up here like diet, different addictive substances, medication, genetics, the environment, how you were born, all definitely will play a role in what our microbiome looks like. And for the vast majority of people, we do have an imbalanced microbiome, which can become a problem. But other things that can become a problem as well, again, how well we're feeding that microbiome and how we're repopulating or fulfilling the microbiome can be a problem, but also this increased intestinal permeability. The layman's term for that is leaky gut. And so when you have leaky gut, those bacteria that are in our GI tract, which, there's a lot of people who compare it to a plumbing system. When we have plumbing and we use the bathroom, it has to go through all these tubes in order to get out, but it's full of bacteria. Same as mouth to anus in humans, it's full of bacteria. It's technically the outside of our body. We don't want it to get into our bloodstream. And when we develop things like leaky gut or insulin resistance or any other inflammatory process in the gut, those bacteria can actually get into our bloodstream, which can become very problematic and inflammatory. So that's what they call bacterial translocation here. The metabolites that I mentioned before, there's several of them. I'm going to hit pretty deep on short chain fatty acids because those are the ones that are most important when it comes to metabolic health. But our microbiome can secrete a large variety of different metabolites that can be both harmful or helpful when it comes to our mental health. So, and then we have more signals that go through things like the vagus nerve or through different organs. But potentially, if we have this all go the wrong way with the imbalanced microbiome, the leaky gut, the lack of short chain fatty acids, that leads to things like major depressive disorder, bipolar, schizophrenia, things like that. So, first, let's eliminate the things that are harmful to the gut. This is, for me, one of the more simple things that you can do. So, number one, unfortunately, medical providers, which I am one, when we're in school, we are taught, especially early on, hey, if they have an infection, give them an antibiotic. Well, not all infections are bacterial. And so an antibiotic will only help with a bacterial infection. But a lot of times patients will come into us and say, hey, I've got this cold that won't go away, or this sinusitis or sinus infection that won't go away. Would you please prescribe me an antibiotic? And we usually get a lot of push from the patient saying, I want an antibiotic. I want an antibiotic. Well, it probably wouldn't be helpful at all anyway, because it's a viral illness, not a bacterial illness. And so you want to make sure you're not requesting antibiotics when you might not necessarily need them. So don't use antibiotics unless you absolutely have to. High fructose corn syrup is another major problem. And so this is really disruptive to the microbiome for sure. Seed oils, which are extremely inflammatory. And for those of you who may not be familiar with that, that's any oil that ends or has the word seed in it, or I always tell people that they either begin with a C or an S. So canola oil, sunflower oil, safflower oil, soybean oil, all of those, if they begin with a C or an S, you want to avoid them, with the one exception of coconut oil. That one is perfectly healthy. Avoiding processed foods and preservatives are very harmful to the gut, and so moving more towards a whole food diet can be helpful. Unfiltered but treated water. And so, as you know, there's a lot of our public water systems that are treated with different things, different chemicals, different antibiotics, different things that have gotten into the public water system, hormones. So if you are on public water, you want to make sure you're filtering your water to try to get those things out. Improving inflammation in the leaky gut piece, excessive alcohol can definitely be a problem. And then this excessively sterile environment, back in the COVID era, we were not exposing ourselves to anything. We're wearing masks, and hand sanitizer was at every doorway that you ever went through. This is something that's actually harmful to the gut. We want to make sure that we are being exposed to different things so we can have a very lush microbiome, whether that be our skin microbiome or our GI microbiome. So what things are beneficial for the gut? So fiber is a big one. Both soluble and insoluble fiber are important. Excuse me, talking too much today. So making sure we're getting a lot of that, whether it be through a variety of different plants or through different supplements that we'll talk about. Having a large variety of plants can also be very helpful. If you're only eating, head lettuce or the bagged lettuces that come, you're not getting enough variety there. So you're not doing anything beneficial for the gut. Making sure that you're using organic fruits and vegetables. If they're not organic, again, they've been treated. The different pesticides that are in there, potentially different things like antibiotics that are introduced into our meats and eggs. They treat those animals with antibiotics, which then will be transferred to you. So using organically sourced food if possible. Incorporating some intermittent fasting is always helpful too. Give the gut a break. If your gut is constantly trying to process things and digest things and whatnot, it doesn't do as well. And so a little bit of a break from food can be helpful when it comes to benefiting the gut. Fermented foods are huge. I recommend to nearly everybody, try to incorporate one fermented food a day. That fermenting process is very, very beneficial at repopulating the gut where in places where it might be lacking. And so sauerkraut, kimchi, kombucha, kefir, you name it, fermented foods are good and something that we want to try to incorporate. Balance is the fiber supplement that I'm going to dive a little deeper into, because it is both soluble and insoluble, which is unlike things like Metamucil or Benefiber. And then last but not least, spend some time outside and get a little dirty. It's good for your microbiome. You are giving it more exposure to more things, so it can have a bit more diversity versus being limited. So I say prebiotics and probiotics, and I always forget that people may not know what that means. And so I like to point that out here. Probiotics are things that are going to give you bacteria. And so this is where the fermented foods comes in. So anything that actually has live bacteria in it or in the process of producing it is going to be a good source of actual bacteria that's going to populate your gut. So things up here, yogurts, fermented veggies, cheeses, etc. Prebiotics are actually the food for our microbiome, and these tend to be our foods that are rich in both soluble and insoluble fiber. They have several listed here. I oftentimes will talk to patients about resistant starches as well, and those are foods that are starchy that we have you cook and then cool them all the way off and eat them cold. They're very beneficial for feeding the gut. They become a more complex resistant starch, which is a great fuel source for your microbiome. So onto these short chain fatty acids. These things are so under recognized, I think. We just are learning more and more about these, but they are just crucial when it comes to your metabolic health. And so again, the microbiome produces these. These aren't something that you can actually just, really take in. There's a few exceptions to that, but for the most part, the microbiome is going to create them. So things like dietary proteins are really important. Dietary fibers are really important. You can also supplement with a few other things. But what we're looking at in my world is how do you boost these things naturally? And why would you want to do it? We're going to improve the immune system. We're going to improve some of this nervous system signaling, the blood-brain barrier permeability, which is good for the mental health pieces there, different gene expression, energy production, insulin sensitivity, et cetera. And so there's a lot of reasons to want to try to increase the amount of short chain fatty acids that the body is producing. And why is this? I'm not going to go into deep detail here, but this just gives you an idea of how many different systems in the body require and benefit from more short chain fatty acids. So we have our lungs, our liver, our muscles, our adipose tissue. This white adipose tissue we want to see be down. We want more brown adipose tissue. And that's what short chain fatty acids do. We want to increase things like satiety. And so we have more short chain fatty acids. We have better functioning brain, which improves the metabolic health. So there's a lot of things here. And I just wanted to kind of drive it home that short chain fatty acids aren't just for the brain, though they're very important, but they're also very important to many other organs. This book I really love. If you are worried about Alzheimer's, whether you have a family history, whether you carry the ApoE4 gene, whatever it might be, this book is an amazing book. Dale Bredesen is the gentleman who has written this, and he has a specific protocol. And he really talks about the fact that we know cognitive decline, Alzheimer's, and dementia aren't just the amyloid plaques that are always spoken of by the pharmaceutical companies. Yes, amyloid plaques are present in a lot of people with those problems, but were they actually the driving force? And he talks about, and I don't remember the exact number, but there's 32 or 34 different, what he calls holes in the roof that will lead to cognitive decline, such as Alzheimer's. And so we want to make sure to plug as many of those holes as possible and reduce the chance of this kind of thing happening. And so what he talks a lot about in the book is something called a 12-3 keto flex diet. And what that means is that you're going to intermittent fast for at least 12 hours a day. You're going to stop eating at least 3 hours before you go to bed. And then he recommends a high fiber, low carb way of eating. And so that's what the keto flex comes to. We're lowering insulin resistance, we're incorporating more fiber for that microbiome. And this can be extremely impactful when it comes to your cognitive state. He does like to have people fast. That 12-hour minimum is important. It does help heal the gut so we can have better mental health. He does recommend things like sunlight exposure too, and we talk about that when it comes to circadian rhythm. When we are resting and when we should be, optimizing our hormone levels, we should have like low cortisol and that kind of thing. So if your circadian rhythm's all out of whack because you're on a screen all day, or you have a high stress job or a high stress family situation, getting that circadian rhythm as close to normal as possible is huge. So get out in the morning. First sunlight of the day is really, really important. If it's dark and cloudy, and I know the weather's miserable back in the States right now, make sure you have some bright lights that you can get on your face first thing in the morning. It's going to help with that circadian rhythm. Getting rid of all processed foods, very, very important because they're so detrimental on the gut. And then he also talks a lot about hormone optimization. And this is where you can go back into my presentation a couple of weeks ago on menopause for women particularly and learn a little bit more about that. But this is also important for men. If we have low testosterone, low DHEA, things like that, it's really important to optimize those for your cognitive health. And so why does all this matter? As you all know, I really like to drive home the point that insulin resistance is one of the underlying factors, or is the underlying factor for a lot of different things. We even have listed at Insulin IQ as one of our plagues of prosperity. Alzheimer's disease is a direct result of poorly controlled insulin resistance. Dementia is also listed on here as well. So why is this? And I don't know if you guys have all heard this yet, but they're now starting to call Alzheimer's disease type 3 diabetes. And that is because it is insulin resistance of the brain. It's the inability to fuel the brain properly, leading to Alzheimer's disease. And so you want to make sure that you're checking for these things early. It does take years, even decades, to go from just being insulin resistance to a type 2 diabetic. So you may not even know you have a problem until it's almost too late. And so we're looking for this hyperinsulinemia, too much insulin. Even if you don't have hyperglycemia, you want to catch this early. And so get a fasting insulin, make sure your level is less than 6. If it's higher than 6, you need to work more on the fasting and the low carbohydrate diet for sure. The obesity is the other thing that plays a role here. And I know this slide's probably small for all of you, but they looked at obesity and or in pregnancy and what happened to the babies. You know, why are we having so much more autism and ADHD and things like that we didn't have 30, 40 years ago? And obesity is a big problem. As everybody knows, it's a big problem, especially in the United States today. And so what does it do? And so here's the different things that they looked at in this particular study, the biggest one here being maternal obesity. And what did it lead to when it came to the baby? Well, it was this autism piece. Autism was seen more commonly in obese pregnant moms than they were in non-obese pregnant moms. And so there's other times too when other things can happen, the preeclampsia, different infections and whatnot. But we do know that this maternal obesity does increase the chance of autism. Up here in the top, they also talk about a bunch of different things here that I'll kind of read to you since I know you can't read them that well, but like breast milk. The interleukin 6, the inflammatory marker in breast milk, goes up. The neuroprotective benefits of breast milk actually goes down. In the placenta, we have higher markers of inflammation, lipotoxicity, oxidative stress. The microbiome in the fetus actually becomes decreased, in particularly this thing called L. reuteri, which is a bacteria that's important. And that will in turn impact the fetal brain. And so we have the oxidative stress, the increase in inflammation, and the decrease in oxytocin, which is really important. And so making sure that if you are entering pregnancy obese, that you want to make sure you minimize that weight gain throughout for the benefit of the mental health of the future child. Now let's move on to fiber. In our world, in the metabolic health world, fiber is a very controversial topic. And I always like to educate people on both sides and let you make the decision based on what I'm teaching you. And so the question is fiber essential? Well, it depends on who you ask. So Dr. Robert Lustig, I think he's absolutely fantastic. He wrote this great book called Metabolic. He is a huge believer in fiber being critical. His little mantra is feed the gut and protect the liver. If you can do those two things, you're going to do a really good job. And part of feeding the gut is the fiber piece. So he likes it because it will increase satiety, it adds more bulk. He talks about insoluble fiber acting like lattice work, you know, and I always do this with my hands. It creates this little matrix of insoluble fiber, stuff that our microbiome can't necessarily eat, creates that. It attaches to the lining of the intestinal tract, and then the soluble fiber comes along and it plugs up those holes. The soluble fiber is the prebiotic part. It's the thing that's going to feed that microbiome. If you only have soluble fiber, it is going to just go through your intestinal tract and it won't be able to sit there and be food like it would be if you also had the insoluble fiber piece. And so it's very important that you're eating a diet high in both insoluble and soluble fibers, or incorporating things like the balance that I'll talk about that already has both insoluble and soluble fiber. So again, it's going to feed the microbiome. It protects the mucin layer. The mucin layer is this layer that everybody has on the inside of their GI tract that if the microbiome doesn't have its own food, if there's no prebiotics present, the microbiome will start eating your mucin layer, and that will lead to more chances of things like leaky gut. So we want to make sure that we're providing the food that the mucin layer isn't becoming the food because of a fiber poor diet. It helps to do things like moving waste faster. Again, you're going to make more short chain fatty acids because of the food that's available. And he even claims that it'll slough off cancer or colon cancer cells by having this high of a fiber intake. Now let's talk about some of the haters. So Paul Mason, and I put him on here, so whoever's watching the recording, if you want to go find these, you can copy and paste the link. This is his YouTube presentation on it, but Paul Mason does a wonderful job talking about his research and evidence when it comes to that you don't need fiber. And so this study they compared a bunch of people on different kinds of diets, and they looked at different things. And I'm sure you probably can't read this either. The red line is constipation. The orange line is strain with defecation. The yellow line is bloating. The green line is anal bleeding. And then that darker bluish green line is actual pain. And so they looked at the baseline diet of these people and tracked their symptoms. Which symptoms are they having? They put them on a high fiber diet. And if you noticed, things like this bloating thing went up, and the anal bleeding and the pain, they went up with a higher fiber diet. They reduced the fiber a little bit and things got better. And then they put them on a 0 fiber diet and there was no complaints. Very, very interesting, isn't it? Here they looked at the short chain fatty acid production. Green is plant-based diet, red is animal-based diet. A lot of people think you cannot make short chain fatty acids without fiber, but you can. An animal-based diet did produce a lot of this butyrate, which is very important with short chain fatty acids. And so you can do this with a very low or no fiber diet. So it is a possibility. Short chain fatty acids, and this is another argument that has been out there, that the short chain fatty acids, if you have them in the gut, it can automatically nourish the different intestinal cells with the ketones that come from that. And so it's not like it has to get into the bloodstream and then go turn around and go back to the intestinal cells to feed it with ketones. You can do that directly. So there's benefit there for the short chain fatty acids. Also, nutritional ketosis. So if you follow a low carbohydrate or ketogenic diet, it will get to the intestinal cells by way of ketones in the bloodstream. And so either way, short chain fatty acids directly impacting those intestinal cells or nutritional ketosis impacting those intestinal cells, both will absolutely work when it comes to the short chain fatty acids and ketones. Another one, Dr. Zoe Harcum, she's fantastic. She's very fun to watch if you ever want to go watch a funny gal talk about different things, especially her poop videos. These are some of her slides that I stole. And so she really talks about that there isn't a lower limit of carbohydrate. We talk about it all the time. Carbohydrates are not essential. You can live without carbohydrates. If you never had another carbohydrate again, you would live just fine. And so her question is fiber kind of in that same way? And her belief is that fiber is not essential either. We can function just fine without it. And those previous slides that I showed you actually also demonstrate that as well. So it is not something that you absolutely have to eat. It's not essential, though for some it can be helpful. And so she looked at some of the different studies out there. And this one, for example, showed that when comparing to all-cause mortality, which is all of, you can't even see my red pen here, all deaths, those who are on a high fiber diet had a 12% increase in all-cause mortality versus those who are on a low fiber, it was 9.9. Heart deaths also, it seemed to be higher in the fiber group compared to the control. Is this something to consider? Maybe, maybe not. And I love this slide of hers. So then she went back and said, well, what are we really looking at? And if you think about the different ways that you can eat, we're looking at carbs and fiber. And so up here, we're having a low carb, high fiber diet. Here, we're having a low carb, low fiber diet. Here, we're having a high carb, high fiber diet. And down here, we're having a high carb, low fiber diet. And so where is the problem in what we've been looking at when it comes to how people are eating? And she does this, I think, lovely. If you think about, if I were to go back to, okay, well, which of these things are people able to get? Which ones are expensive versus inexpensive? Who's focusing on these kinds of diets more so than others? And so she uses like Gwyneth Paltrow as an example. I believe she's vegetarian and she's eating more in this high fiber, either higher or lower carb realm because she can and she can afford it. The general population who doesn't have access to it, you can see here, tends to be your poor people with little financial resources, little access to whole organic kinds of foods. And so her question is does fiber make people healthy, or do healthy people just eat fiber? And I think it's a very compelling argument when it comes to what people are actually eating. So she went through and she broke it down. If we're trying to get the guidelines, the amount of this 30 grams of fiber per day, how are most people doing it? Well, here you can see it's a high calorie, high carbohydrate, high sugar way of eating. This is not what we want to do. We don't want to have this be how we're achieving our fiber goal. So how do you do it a little bit differently? She put it into another slide where if you're eating, better lower carb, whole food fiber, that you can actually achieve that fiber goal with significantly less calories, carbs, and sugar. And so if we want to go that route when it comes to fiber, that's how we want to do it, not with the higher calorie, higher carb, higher sugar version of fiber. And so what do we want to do? These are the things we want to do. If you're pregnant, you try to give birth vaginally. It helps the microbiome. If you can breastfeed, it's definitely better for the baby. Incorporating the probiotics in your diet and then eating a high protein, high fiber with both soluble and insoluble fiber diet. We don't want you to do things like this. We have antacids here, antibiotics that I mentioned before, and the standard American high carb, low fiber diet. So those are some simple strategies to start with for sure. What about probiotics? I get this question a lot. So should I just take a probiotic? I can go get it at the natural food store or whatever. You can, but here's the recommendations that I have for people. If you're going to get a good probiotic, we want them to have a large number of different bacteria in it. So this is the one that I tend to recommend to people versus something like Culturelle, which tends to only be lactobacillus. And so get one that has multiple strains of bacteria in it. Make sure you get a good quality brand, that it has been regulated as far as temperature control and packaging. If they got to high heat or if the packaging's been tampered with, it's probably not doing you any good. I do not recommend to take them regularly. So I tell patients who want to go on a probiotic that I want them to cycle it 2 weeks on and 2 weeks off. We can create SIBO, small intestinal bacterial overgrowth, with too many probiotics. What if you're feeding your microbiome one specific probiotic all the time and it becomes overgrown? And then the bacteria that you do want don't have a place to live because it's overgrown with this other one. And so I don't recommend to take them regularly. Take them cyclically. I always recommend to take them after you've been on an antibiotic, because the antibiotic will destroy your microbiome and you need to reflourish that microbiome. I recommend to take them during antibiotic use. The only time I would say don't take them during antibiotic is if you are specifically targeting a GI bug. If you're looking to decrease bacteria in the GI tract, well, then you don't want to take a probiotic while you're on it. But if you're taking an antibiotic for a sinus infection or a pneumonia or something like that, absolutely take the probiotic while you're on the antibiotic to try to keep that microbiome intact. So, and then yes, you might want to consider target specific probiotics. Akkermansia is a really good example. Akkermansia is very beneficial when it comes to controlling blood sugars. And so if you're struggling with your blood sugars, you think it's coming from your gut, maybe targeting with something like Akkermansia is good. Saccharomyces boulardii is another one that I'll use a lot of times, because that one is really good for things like C. diff if you've been on a lot of antibiotics, or heavy doses of antibiotics. That Saccharomyces boulardii can be very helpful. And then what about the fermented foods? And I put in here Ben, if you didn't know, if whoever's watching doesn't know, I do work with Ben Bickman over at Insulin IQ, and he is a huge proponent for fermented foods. He really recommends it. You can go back and catch his metabolic classroom on fermented foods. If you, like I said, cut and paste this link or go search him on YouTube, you can learn all that he has to say about it. There is no reason why someone shouldn't be taking in a fermented food. And there's so many different ways to do it now. I even tell people, pickles. Most people like pickles. And if you can get a fermented pickle, not just a pickled pickle, because they're very different. Pickled pickles are just there in vinegar. You want to get a fermented pickle, but you can do that. But a lot of the health food stores now have fermented everything: onions, a variety of vegetables, the different low sugar kombuchas, the kefirs, that kind of thing. But here's one other problem with the fiber piece, and Ben talks about it, I believe, in that same video, is we know that there's a lot of people out there who say too many plants is bad. We have these anti-nutrients that plants give off that can, one, keep us from absorbing the nutrients we want, but two, also create other problems. Oxalates is a really good example of that. If our oxalate levels get too high, we end up with things like kidney stones. And so there are some theories out there that, yeah, some people are sensitive. And if you want to know if you're sensitive to some of these food items or these anti-nutrients, my recommendation is to eliminate them for about 6 weeks and then add them back in. If you don't notice any difference in how you feel, you're probably not sensitive to them. If you reintroduce them again and you're like, whoa, I'm inflamed, I don't feel well, my mental health is worse, whatever it might be, then you know that you might be sensitive to some of these anti-nutrients. So now the question is what's the right answer? Fiber, no fiber, fiber, no fiber. Do I do this or do I not do this? And the answer, in my opinion, is simply you got to try it for yourself. Everybody is different. I have lots of patients with inflammatory bowel disease who do exceptionally well on a very low fiber diet or a carnivore style diet because the inflammation is driving the majority of their symptoms. I have lots of people that take out fiber and they feel terrible. Their bowels stop working, their gut goes to crap. And so it really is you have to try it and see what makes you feel the best because nobody, it's not a one size fits all kind of scenario. So the good news is, and hopefully based on what I've told you tonight, is that there's benefit from either or both. You could do a moderate fiber diet, you could do a zero fiber diet, you could do a high fiber diet, and you're still going to get benefit when it comes to your gut and your mental health. So what would I suggest? First and foremost, really easy, start intermittent fasting. That to me is a no-brainer for most people. Even if you don't want to skip a meal a day, keep your eating to your meals. We call it time restricted eating. And so only eat at your 2 to 3 meals a day. Don't snack in between. Again, whole food, low carbohydrate is the best way to go. Find the fiber dose that feels right for you. Don't be, persuaded or convinced one way or the other, because again, your gut is very different than somebody else's gut. One way might be better for you than others. And then the Feel Great system, I did want to hit on this a little bit more because this is an easy way to do it, especially if you're worried about things like those anti-nutrients. So it's fiber made easy, like I said here. It is a unique blend. It has both the soluble and the insoluble fiber. It tastes really good. It's easy to take. It's not a whole bunch of pills and supplements and all of that. And you don't have to worry about the anti-nutrient piece of having a diet that is really high in vegetable sources. And so this is a simple one. If you're interested in this, please message me and I can share the link with where to get it. So last but not least, thank you very much. Hopefully this was really helpful and answers your questions about the gut-brain connection and how you can improve your mental health, prevent cognitive decline by simply changing the food. So let me exit out of here and I'll go get on to, my phone and see if we have any questions in the chat. And please, if you do have questions, go ahead and put them in and I will get to them as I can. Several people watching and tagging others. Thank you so much. But I don't see any questions or comments. So I'll hang on here for another minute or two. This will be posted to my YouTube channel. And so just go to Venn Integrative Medicine on YouTube. You can find all of the recordings after the fact. And again, if you have questions later on, if you're watching the recording, you can certainly send me a message there or go to my website at Venn Integrative Medicine in order to message me directly. So awesome. And of course you can comment on the Facebook page as well. I'm happy to answer questions there. So yay. Well, I don't see any other questions coming in. It's Monday night. It's been a long day for me. So I will go ahead and let this go. Rosa says, thank you. You're welcome, Rosa. So yeah, thanks again for joining. I'll try to do another one again this week. If I can't get to it, it will for sure be next week. So we'll keep them coming. And if you have suggested topics, you can always message me with a topic you would like for me to cover. I'm happy to do that. So Lindsay says, thank you. Lisa